As we begin our discussion of solution-focused therapy, we'll look into the history, evolution, and major contributions, as well as philosophical framework and skills that go into solution-focused therapy, as well as some of the ethical challenges. So, some of the exercise questions include Tolstoy's short story of the 3 questions. There's a tale of a king looking for the right time, the right place, and the most important thing to do. And some of this also includes who are the most important people to do this. And this ties in as a metaphor for the work that we do when we're doing solution-focused work. So Nikolai is a young boy, and he seeks counsel. And essentially the 3 questions are, when is the best time to do things? And many times that is true as well when we think about change. So changing our behavior. We've talked before, or will talk, about the stages of change by Prochaska, Norcross, DiClemente. And a lot of times we know we need to change, we want to change, just not yet. So sometimes it's not that I'm not ready to change, it's just that I want to eat the chocolate chip cookie or do other things right now and save the workout for some better time into the future. Who's the most important one? So as part of this process, right, is there a place, is there a person or someone that should handle the work of change? And of course, in solution-focused theory and therapies, the client is the expert, more so than the helper. And what's the right thing to do? And this is where our ethics and our value propositions come into play. What's the right thing to do? A lot of times we'll align our goals with those of our clients so that we can make sure that we're focusing on what they would have us do. So this becomes a metaphor for our work. The best time, the most important one, and the right thing to do. This involves, especially in counseling or social work, concrete services. That's case management. It often involves getting things for people who need, for instance, gas or electricity or transportation, regular things that they might need. Active exploration with clients in session. Silence and the appropriate use of silence. Also being present. Having the right timing and knowing when to encourage versus when to challenge or confront. There's also a social justice perspective that at times we might need to advocate for our clients, and also a sense of doing and being. So reflecting on your own experience, where there's feelings, comfortably, uncomfortably, anxiety or confusion, sometimes we're not sure exactly how to approach clients in these moments. What should I do when? What to do? How do I integrate my faith if clients have a different value or theological or religious perspective than I do? And sometimes that can be challenging for us because we want to be client-centered and yet also be true to ourselves with a sense of integrity in who we are and who God has made us to be. So we don't only provide concrete services, but by our presence we provide the experience for change to happen. Our presence may also challenge the world to greater justice. So we are change agents in the world. So some of the assumptions of solution-focused approaches. The client is the expert. So we never want to take that away. It's not as much that we are experts and we tell clients what to do, but rather things are focused on what does the client want to achieve? What's their goal? The problems and the solutions are not necessarily connected. So it might seem like an easy solution is readily available, and yet that's rarely the case. Sometimes clients have to come up with solutions that are going to work on their own terms. Part of what we do is we make unsolvable problems solvable. So it means breaking it down into bite-sized chunks and having goals that are SMART. Certainly we can look up SMART goals. That comes from the military. But specific, measurable, achievable, realistic, and also trackable so that we can find out ways that we're able to actually show that the needle is moved on making progress. Keep it brief. So we're not going to change the world necessarily, but we're going to change one element of the world in our clients' lives. And that will then be something they can build upon for greater, bigger, broader changes. And we also focus quite a bit on perception. So what is the perception the client brings to the session? So some of the basic tenets. Joining. So there is a high level of rapport between therapist or clinician and client, so we want to join with them. We want to establish rapport and relationship. There's a lot of normalizing in what takes place in goal setting. So it's important not to catastrophize even if our clients do. We use a lot of the CBT approach of reframing things And we'll often put a positive spin on this. Certainly the readings around solution-focused approaches talk about the glass being half full instead of being half empty. Sometimes there's paradox. Paradox is really the opposite of what you would think. So in using a paradoxical intervention with clients, we might prescribe the symptom and say, maybe you should do more of this. I'm trying to eat healthier. And it might be, well, maybe you should eat more chocolate chip cookies. And that builds awareness. Well, I probably shouldn't, and I know that. Then what would it take to change? Non-pathology. So there's really not a lot of diagnostic work that happens in solution-focused interventions. Essentially, when we do this type of work, there's very little looking at mental illness or diagnostic criteria. It tends to be very much focused on future goals and really doesn't look backwards in time, but rather is teleological toward a future time. And there's focus on small changes. So the client is the expert, and that's really important. Again, we're coming alongside, we're joining with our clients in a way that is future-focused and strength-based, and really they have the answers. We assist the client in the construction of the solution, so asking a lot of probing questions. Would that work? How would that work? What would it take to make this type of situation work, as you've suggested? The miracle question. If you were to wake up tomorrow and this problem was resolved, what would it look like? Describe it for me. From the moment you get out of bed, what would be different? And start asking and looking for clarification on how things would be different if this miracle actually occurred in their lives. The cup, as I said previously, is half full, so it's looking at things from a very positive perspective. Also looking at the role of language in the construction of reality. And this is really significant as well in other approaches. Certainly cognitive behavior therapy looks a lot into thinking processes, as does ACT in the role of psychological flexibility. So language itself is important, and how we use our words matter. So some of the theory-based tenets. When you go to sleep tonight, imagine a miracle happens. Because you were sleeping, you were not aware of it. The miracle is that when you wake up, you'll no longer have the problem that brought you to therapy. Upon awaking, what will be the first sign that a miracle has happened? So these are things that really started with logotherapy with Viktor Frankl, who is a Jewish psychiatrist. And essentially, a lot of this started here. So looking at the vision of what would happen in the future if this were to succeed. If we were to be successful in our goals, what does my perfect future look like? He was a prisoner in a concentration camp and thought about the future. If he survived, what did he want his future to look like? So of course we bring back that positive perspective of the cup being half full, and also the role of language is vital. So some of the treatment goals. A lot of times in the early stages of solution-focused intervention, there were two-way mirrors. A lot of it was videotaped. There were consulting teams. And really solution-focus stemmed from some of the earlier family systems-based approaches where there was a lot of group therapy procedures, such as a consult team or supervisors that would view and watch the session itself and provide extra guidance and support for the therapist in session, but this is rarely done anymore. It's incredibly expensive. If one therapist is expensive, 2 or 3 is even more so for clients, and insurance would never cover that anyway. So most have gotten out of that unless it's a training type situation. So some graduate programs who train in solution-focused and family systems theory and structural or strategic therapies will sometimes use these types of models where a supervisor is behind the glass, or even fellow graduate students are behind the glass and can ask questions or call in or help consult with the client. But other than a training situation, this rarely happens. So what does a solution-focused session or series of interventions look like? Essentially, number one, the person who's motivated toward change is the person that we really focus on as a helper, the person who will ensure that the change will occur. So this is both the strength of solution-focused interventions as well as a challenge. So if someone is not necessarily motivated to change, then this is probably not the best intervention for them. They listen. There's rapport, empathy, joining, reflection, and summarization. Looking at problem talk to solution talk and setting the stage for change. The miracle question's often used even in the first session, which helps then to generate goals. So why are we here? That's part of our assessment, and what do we hope to accomplish? And that's our goals. Second session, repeating the first session tasks, looking at making positive changes and highlighting those things that have worked well over the previous week. asking, is this a new behavior? How do you explain it? How are you able to do that? How can you continue to keep it happening? So it really is focusing on the good and maximizing the positive or the good in what happened from week to week. Session 3, it's really a repeat and building on the strengths and the things that have gone well over the previous week. And then thinking through each session until completion, we really don't encourage problem talk or further elaboration of feelings. So when we think about, how do you feel about that, and a lot of the stereotypical things that come with some types of therapies, solution-focused really does not spend a lot of time on elaborating feelings. It's just not that important. We're really focusing specifically on thoughts and taking a more strength-based, positive, growth-oriented, to use Carol Dweck's language, approach. And really from there, the only importance of feelings is that it helps to tell the story and to motivate and gauge the level of readiness for change. So the interventions, again, joining, normalizing, asking circular questions. Well, then what? Then what would happen if you did that? Then after that, what would happen if you did that? Coping questions, the miracle question as we talked about, scaling questions. So on a 1, thing is low. On 10, this event is very high, or you're very happy. What would that look like, or where are you now? And when they respond with a number, then you pick a number up or a number down and grab more clarification from the client in their own language. What are the exceptions to the rule? This always happens. When we get together, we always argue. Okay, well, has there ever been an exception? Has there ever been a time that you've gotten together and you did not argue? Or is it every single time? Absolutely. And if so, how have you maintained your relationship this long? Formal tasks, right? What are things that we're actually going to do? And that could be in the form of homework or other things that we assign to clients or agree upon. Hypnotic situations, hedging words, and then looking at the team. So who are the support people in the client's environment? It could be a boyfriend, girlfriend, spouse, parent, aunt, uncle, even sometimes children, to say, here's what could be done differently. So interventions are most effective when there's clear, appropriate boundaries, such as individual, family, and generational, and also if the client or family has structure and style, strength and health. So if they're a healthy type family, it's going to be more successful than if they're dysfunctional or if there's other secondary comorbid disorders like substance abuse or addictions or domestic violence that could get in the way. And also the ability to allow for resolution. Sometimes people have a lot of water that's gone under the bridge and they're just not willing to forgive, they're not willing to work on things, and maybe they're currently in therapy or in counseling because they've been threatened. Either you go to counseling or I'm leaving, I'm filing for divorce. And maybe they're not ready to work, there's a lot of bitterness, but they're going just to satisfy that, okay, I went to counseling. And in which case it's probably not going to be very effective. So some of the ethical challenges is that the therapist must take a position of not knowing and must learn the solution from the client. And this is hard, especially when we've been doing this for a while. When we learn and have a sense of what works in couple process or family process or even in success in life, we know that certain things work and certain things really tend to drag us into problems, like certain addictive behaviors or ways of responding or dealing with anger or emotional regulation or impulsive behavior. And sometimes it's hard not to call clients out or at least to identify a problem when we see it. And yet we really have to work at the speed of the client and allow them to take the lead. It requires a shift in our paradigm that really we're no longer the expert. So even though we have advanced knowledge, we have to trust where the client is and what they're working on and in their own timing. It rejects insight, problem-focused, detailed assessments, and the right to be an expert in this type of counseling approach. We're really inquisitive and we're maintaining a beginner's mind instead of coming at clients with a sense of, I'm an expert and I'm here to help. So some of the strengths and the assumptions when we look at strengths perspective and solution-focused counseling. The assumptions are all people and environments have strengths. So even when we think about our most challenging clients and their most challenging environments with significant challenges, there's still strengths there, things that we can build upon that are going to help promote positive behavior change. Client motivation is fostered by emphasis on strengths, so that's important. The process of cooperative exploration helps to discover those strengths. Strengths do not blame the victim, so we never want to get in a position where, regardless of the level of dysfunction or trauma that we're working with, we really never want to blame the victim. And all environments themselves have resources, things we can tap into as we're helping others to take ownership of their lives. Interviewing clients with strengths using solution-focused approaches, we look at the present and past successes. So even though there may be significant problems and we start to triage where are the most important problems likely to be found, we look at also past successes that have happened over time. Everybody has things that they've built upon. Scale the progress, confidence, self-esteem, followed by affirmation and amplifying those positive things. So we're really building confidence in helping clients to take ownership of their problems by finding solutions on their own terms. Coping helps understand strengths in difficult situations, so we help the client affirm their story, recognize survival successes, and we ultimately empower our clients to discover the power within and foster belonging, uncover resources, and establish the motivation to achieve. So at this point, would like to thank you for your participation in viewing this video. If you have any questions, certainly reach out to me. For the time being, this is our summary introduction on solution-focused approaches. Have a great day.